This is a contrast CT scan of a 28 years old female patient. The patient presented with mass lower abdomen and menorrhagia. Now please observe that on right side there is mild hydronephrosis. Mild fullness of collecting system is present on left side as well. Now, this is the slightly dilated right ureter, thick and enhancing wall, slight inflammatory stranding of adjacent fat. I will talk about its details later on. Now please observe this mixed attenuation mass lesion in lower abdomen extending downwards into right side of pelvis. Its upper part is predominantly cystic. Significant amount of solid component is noted in its lower part. These are the tiny calcifications in the solid component of the mass. These represent Psammomatous calcifications and are quite typical of the serous cystadenocarcinomas. The patient CA125 levels were markedly elevated and were more than 1000. Please observe that this is displaced uterus towards left side. Its interface with the adjacent uterus is indistinct. A similar mass lesion is present on left side as well. Now this may represent either a simultaneously present left ovarian serous cystadenoma or a metastatic lesion. This is the sagittal scan. Same findings. This is a subserosal fibroid, this one here, involving posterior wall of the fundus of the uterus. The rest of the uterus is essentially normal. Now this is the left ovarian mass. This is the delayed scan. Please see the dense non-homogeneous nephrogram on right side. Excretion of contrast medium is slightly delayed. Mild hydronephrosis. This is right ureter. Slightly thickened walls enhancing. Significantly slight stranding, inflammatory stranding of the adjacent periuretral fat. This is unlike the left ureter. Now this is not because of the involvement of right ureter by the pelvic mass. There is a calculus here. Now this one is the calculus here. This has obstructed right ureter, resulting in mild hydroureteronephrosis and the dense nephrogram. I will show you this calculus on the sagittal scan. This is the sagittal scan. Now this is the calculus here, this one. This has obstructed right ureter. So he must look carefully. Now this is the dilated right ureter with thick enhancing walls, suggestive of ureteritis. So in such cases, we must always look for any other cause of the ureteric obstruction rather than the ovarian malignancy. This is the delayed scan of the pelvic masses. There is no involvement of adjacent gut segments or the urinary bladder.